Now we will see the MCQs. First one, the respiration is controlled by the respiratory center in the brain called. Options: A. Hypothalamus, B. Midbrain, C. Cerebellum, D. Medulla oblongata. So here the right answer is option D, medulla oblongata. The respiratory control center is situated in the medulla oblongata and pons in the brain. Explanation: respiratory center is responsible for maintaining respiration rhythm and adjusting homeostatic response. It is located in the medulla oblongata and pons of the brain stem. So the respiratory control system is present in the medulla oblongata and pons of the brain stem. So the correct answer is option B. Next question. Total cessation of breathing is called. Total cessation of breathing is called what? Options: A. Tachypnea, B. Bradypnea, C. Apnea, D. None of the above. Tachypnea means increased breath rates. Increased respiration is called as tachypnea. Bradypnea means lowering the breath rates. That means lowering the respiratory rate is known as bradypnea. So here the correct answer is option C, apnea. So here the explanation: total cessation of breathing is called apnea. During apnea, the muscle of inhalation stop their movement. Okay, so total cessation of breathing is known as apnea. Increasing respiratory rate is known as tachypnea and lowering the respiratory rate is known as bradypnea. So here the correct answer is option C. We will see the next question. Blood in the urine is termed as. Blood in the urine is termed as what? Options: A. Hematuria, B. Suppression, C. Polyuria, D. Hemophilia. So here the correct answer is option A. Blood in the urine known as hematuria. Blood present in the urine we will called as hematuria. We will see the explanation. Blood in the urine is termed as hematuria. Infection is one of the most common cause of hematuria. So blood in the urine called as hematuria. Here the right answer is option A. And the most common cause of hematuria is a infection. Infection is the most common cause of hematuria. Next question. The most frequent mode of infection transmission is. In the infection transmission, the most frequent mode, what is that? Options: A. Contact transmission, B. Droplet transmission, C. Airborne transmission, D. Vector-borne transmission. So the most frequent mode of infection transmission is option A. Contact transmission. Contact transmission is the most frequent method of transmission. Here the explanation is: the most frequent mode of infection transmission is contact transmission, which transmits through direct person to person contact. Okay, so contact transmission is the transmission through person to person. Okay, simple prevent measures can cut down the contact transmission. Okay, simple cut down measures are the prevention of this type of transmission, like frequently hand washing. Okay, next question. Contraindication of cold application is. Cold application contraindication. Okay, options: A. Hypothermia, B. Muscle spasm, C. Cold allergy, D. All of the above. So what is the right answer here? So here the right answer is option D, all of the above. Contraindication of cold applications are hypothermia, muscle spasm, cold allergy. These three are the contraindications of cold application. Cold application decreases the temperature, so hypothermia will come. Okay, increases muscle spasm and trigger cold allergy. So cold application is contraindicated to hypothermia, muscle spasm and cold allergy. So here the right answer is option D, all of the above. Next question. Phantom pain occurs in. Options A, heart, B, amputation part, C, stomach, D, none of the above. What is the phantom pain means? Person feels pain where the missing body part should be. So phantom pain is a person feels pain where the missing body part should be. So the phantom pain is a amputation part pain. So there is a missing of a part. There is a pain. Okay. Phantom pain is a feeling of pain from a body part which is amputated. It may feel like cramping, crushing, twisting or smashing. Okay. How that pain like cramping, crushing, twisting or smashing. Okay, the pain feels like cramping, crushing, twisting or smashing. Okay, so the correct answer is option B. Next question. Substances used to counteract the effect of poison are. Substances used to counteract the effects of poison are. And options A, antibiotics, B, androgens, C, antidotes, D, antiemetics. Antibiotics works like against the infection. Okay, what is androgens? Androgens are the hormones that are present in the males. Okay, antiemetic means works against the vomitings. Okay, so here the correct answer is option C, antidotes. Antidotes are the agents that counteracts against an effect of a drug or poison. Okay, so here the right answer is option C. Substances used to counteract the effects of poison is antidotes. Okay, poison ki against ga iche vaatini antidotes ani antam. Okay, next question. The angle of insertion for intradermal injection. Intradermal insertion angle. Okay, options A, 15 degrees, B, 25 degrees, C, 45 degrees, D, 90 degrees. Here the right answer is option A, 15 degrees. The angle of insertion for intradermal injection is option A, 15 degrees. Best example of intradermal injection is BCG vaccine. BCG vaccine we will give at birth babies. Okay, BCG vaccine we will give by this type of intradermal injection, and the angle is 15 degrees angle. Okay, we will see the explanation. The angle of insertion for intradermal injection is 5 to 15 degrees. It is administration of injection between the epidermis and hypodermis. Next question. The difference between oral and rectal temperature is. Oral and rectal temperature differences what it is. Options A, 1 degree Fahrenheit, B, 2 degrees Fahrenheit, C, 3 degrees Fahrenheit, D, 4 degrees Fahrenheit. So here the correct answer is option A. The difference between oral and rectal temperature is 1 degree Fahrenheit. We will see the explanation. The difference between oral and rectal temperature is 0.5 degrees Fahrenheit to 1 degree Fahrenheit. rectal temperature reading is the most accurate than oral temperature reading. So the rectal temperature reading is the most accurate. Okay. Next question. In putting sterile gloves, which should be gloved first? In putting sterile gloves, which should be gloved first? Options: A, the dominant hand, B, the non-dominant hand, C, the left hand, D, no specific order. So what is the right answer? Here the right answer is option A, the dominant hand. While putting sterile gloves, we will gloved first dominant hand. We will see the explanation. The dominant hand should be gloved first. It can minimize risk of contamination and ripping. So why we should gloved first dominant hand means it will minimize the contamination of microorganisms and ripping. That's it for today's video. If you like this video, please like, share, comment and subscribe. Thank you so much for watching. We will meet in our next video. Please subscribe and comment, like and share.